Okay, we're going to begin the assessment of the ears, nose, and throat. Before we start, we want to get our equipment together, and that'll be an otoscope with a pneumatic attachment. We don't have the pneumatic attachment here, but we do have the otoscope that we will be using. I'll describe how to use the pneumatic attachment during the video. We'll also be using a nasal speculum. We'll use this one, and a tuning fork, we will substitute for a regular fork right now. Gauze, gloves, a pen light, and if you're able to get some vials with different odors, that would also be useful in this examination. So let's start with the ears and the hearing. So we're first going to assess the external ear. That includes the auricles to begin. So let's go ahead and take a look at this patient's auricles here. So go ahead and turn your head over to the side. Okay, so we are talking about this organ, or this protrusion here of the head, also called the pinna. So what we're looking at here is we want to assess the size, the shape, the symmetry, any landmarks that you might be seeing here, and the color and position of this auricle. Now, we're going to work our way into the ear for now, but the auricles, what we want to take a look at is that the color of it is the same color as the facial skin here. Don't be surprised if you see any thickening along the bridge of the helix. That's what we call a Darwin tubercle, which is normal. Also, sometimes there may be some tags, some skin tags in the preauricular area, or maybe even pits here in this area, and those are also normal findings, so be aware of that. Now, as far as the shape, there are some auricles that you may see are they're called cauliflower ear, and they are not spherical as you see here. They're not rounded like you see here. They look a little different in shape, and those could be a cause of blunt trauma and due to necrosis of the underlying cartilage area here. So those are abnormal findings that need to be noted. Now, any lesions or discharge coming from the ear also need to be assessed. Now, going back to the color, if you see that the color of the ear is somewhat of a blue color, that may indicate cyanosis and something occurring in the body that is causing that cyanosis or lack of oxygen. Now, if you have pallor or excessive redness in the ear, that may lead you to believe that there is some vasomotor instability there. So all of these things are very important to note. Now let's go ahead and move on to the position of the auricle. Now we're going to ask this patient to look straight up near. Now I went ahead and used this ruler here just to kind of help as far as with the position of the ear and to assess it. Now what we want to do is we want to sort of draw an imaginary horizontal line between the inner canthus, I don't know, you're going to be staring at me, between the inner canthus of the ear, and then we're going to go ahead and draw the line to the most prominent protuberance of the occiput. So that would be about here. So right there, what we want to see is that the top of the auricle should be at or above this line. So as you can see here, it is a little above it, and that is normal. Now, after we draw that imaginary line going horizontally, we want to draw another imaginary line going perpendicular to it, or vertical to it, and we want to make sure that when we draw this vertical line that the ear doesn't fall any more than 10 degrees lateral of it, lateral to the posterior angle, because that could be indicative of some chromosomal aberrations or maybe even some renal disorders, also if they're lower set. Now let's go ahead and inspect the external auditory canal. So we're going to go ahead and have him face the camera once again. Now we want to inspect to see if there's anything coming from the canal, any discharge, odor. Now if we see that there is some odor, purulent or foul-smelling discharge coming out of this ear here, that could be diagnostic for otitis externa, perforated acute otitis media, foreign body. So basically any type of infection going on in the ear there. Now if there is discharge that's bloody or serous in color that is coming out, that could be indicative of a skull fracture. So moving on, now we have to palpate the auricles in order to continue to assess. So what we want to do is we want to make sure that they are firm, okay? And when we fold them forward, that when we let them go, they go right back to where they need to be. Also, when you pull the lower lobe here, this lobule, if he is having pain, tenderness, whenever I pull here, it may indicate that there's an infection in the external ear, some inflammation or swelling. So that is an abnormal finding there. Now, as far as the mastoid area, we also need to assess that one right behind the ear here. So what we want to do is go ahead and palpate and ask him if he's having any pain or swelling. Are you having any pain or swelling?
No.
Okay, so if he did, this would also indicate an infection which could possibly be mastoiditis. So that is something to also assess. Now, while we're palpating, we want to make sure that we don't feel anything hard and protruding like a nodule. So this is pretty clean there. So now let's move forward to the otoscopic examination. Now, we're actually going to start using the otoscope at this time. So what we're going to do is we want to make sure that we clean the otoscope between every patient to make sure that we don't start any infections or move any material that we don't want into another ear of another individual. So make sure that you clean this with an alcohol swab or something like it. So what we want to do, we want to go ahead and tilt the patient's head toward his opposite shoulder, and we will be standing at this time. So what we want to do is we want to go ahead and hold the speculum in some manner to where our thumb and index finger, it sits right in between, and it's supported by our middle finger just like this. So what we end up doing is we end up resting the ulnar portion of our hand on the patient's head here, and then what we do is we use our other hand to pull this the auricle up and toward you, so as to straighten out the auditory canal a little bit better, so we are better able to see the tympanic membrane and the meatus. So since we are not able to show this on the video, I'll go ahead and describe what this would be like. So when you're inspecting the auditory canal, we want to make sure that the speculum is large enough to where it fits nice and comfortable, and we want the largest speculum that we can to fit into the patient's ear to see better. When we insert the speculum, we want to make sure we don't go further than 1 to 1.5 centimeters in length, and also make sure that we avoid hitting the bony walls in the inner 2/3 portion of the auditory canal, because it can cause pain. Now, when we're assessing the auditory canal, we want to make sure that there is no discharge or scaling around the area, redness, lesions, any foreign bodies. There may be a minimal amount of cerumen, and that's okay. What we're looking for is large amounts of cerumen that are not supposed to be there. It should be pink uniformly. It should have hair in the outer third of the canal. All of these are normal findings. One more time, whenever we're going into the ear, just make sure that when you got to keep your head straight, just like that. Tilt your head toward the opposite side of your shoulder, and then what we do is we pull the auricle up and back to kind of make it easier to see. So in this case, the otoscope in itself, it has a little light here, and you want to make sure that is on right before the assessment. And then when you do, you want to go ahead and tilt your head a little further, and then up and back, and then that's when you start looking at the canal here. So what I can see here is pretty clear. I can see the tympanic membrane, and I'm looking at the auditory canal around. I see tiny little vessels everywhere. I don't see any cerumen anywhere, pretty clean. And then I'm looking here to take a look at the tympanic membrane, and I see that it is grayish, pearly gray in color. It is transparent, and right in the middle of it I can see the umbo, and I can also see, and I can also see the landmarks. The umbo, I could see the hand of Malleus going upward, and the annulus. Now we're going to go ahead and stop here. We're going to continue the next video, the next part, or the continuation of this assessment in the next video.